Alrighty. My name is Christopher Racine. I am the VP of Engineering here at Environ. I've been here about 2 years, and I help lead our energy management and engineering groups, work with a diverse set of customers, with healthcare being a primary focus for us. Jeff, could you introduce yourself?
Hello, everybody. My name is Jeff Hogan. I'm a principal here at Environ. I work across mostly our hospital clients, looking to deliver our comprehensive set of services to those large healthcare organizations.
Thank you. To go over the agenda, um, Jeff, if you don't mind flipping slides, thank you. We are going to kind of go through the introduction of grants and incentives and how they apply to infrastructure upgrades and deferred maintenance. We will go over energy management programs and why EMPs are kind of essential to setting up the foundation to really execute on incentive programs. We'll go over the funding landscape, how kind of changes at the federal, state, and utility programs, as well as kind of short or longer timelines are affected. We're going to go over stakeholder engagement, how you internally and externally plan so you can properly achieve those incentives and ultimately execute the projects those incentives are based around. We're going to review utility budgets and contracts because ultimately managing financial and operational impacts is imperative when we are talking about infrastructure upgrades. We'll go through a case study as well as kind of how you develop a business case that's ROI based, but also factoring in the kind of ancillary benefits of a lot of projects. And then lastly, we will end with kind of an action plan. What could you do to start? How would you kind of begin the journey of really trying to take advantage of these incentives in a more programmatic way? Before we go through this agenda, I'll do a quick intro on Environ as well. So Environ started in 1995. Mark Menenberg founded Hospital Energy, and then in 2021 joined 424 Capital to ultimately start Environ Energy. And then over the past 4 years, we have acquired different companies to really broaden our service offerings. So I come from the engineering side, which was acquired in 2023. We have a sustainability practice. We have a carbon tracking tool. We also have a much more diverse kind of energy procurement background across multiple geographies, pretty much all 48 continental states. In terms of what we are trying to do, what our mission is, we believe we understand kind of what it takes to start to move forward into a low carbon future and how to make smart energy and financial decisions while also trying to make progress on these complex goals that a lot of us are setting or trying to achieve. These organizations are a lot of times faced with a matrix of decisions, and the environment seems to be changing under our feet. And we believe we have a pretty good understanding of kind of where the ground currently is, where it's going to be, and what changes could potentially be expected. And we try and help our customers through that journey. Jeff, kicking it over to you.
Thanks, Chris. So across the U.S., healthcare facilities are grappling with aging infrastructure. I think as everybody understands here, that not only raises operational costs, but also jeopardizes patient safety and care reliability. More than half of the hospitals were built, over 4 decades ago, often with outdated systems that are very energy intensive and sometimes difficult to maintain. At the same time, a convergence of public and private funding mechanisms is creating unprecedented opportunities to address these challenges. If organizations can navigate the complexity of eligibility, alignment, and the application, this is where energy management programs become essential, not only to improve performance, but to serve as a tactical foundation to capture these funding streams. This webinar will walk through these opportunities in depth, highlighting how to bring together stakeholders, align incentives with strategic goals, and build a business case that ensures successful funding and implementation. An energy management program, or an EMP, isn't just about cutting utility bills. It's a strategic tool that anchors long-term infrastructure investment. At its core, an EMP provides a framework for continuously assessing, optimizing, and upgrading how energy is consumed across a facility or a portfolio. Importantly, many federal, state, and utility incentive programs look for and sometimes require evidence of energy planning. A documented EMP, energy audits, or baselining exercises can dramatically increase the chances of securing grants. It also shows intent, readiness, and the capacity or capability to follow through on the projects that you identify. Moreover, EMPs help ensure that capital upgrades align with broader organizational goals that could include, but are not limited to, improving patient care, environments, supporting carbon reduction goals, or increasing climate resilience or just resilience more broadly. And by sequencing improvements, you can optimize both timing and return on investment or ROI. And I think we want to pause here to ask a question to the broader group, whether or not you have some type of energy management plan in place. Interesting. So 47% yes, 40% no, and 14% not sure. Hopefully the folks that have them, we can provide some insight on how to improve it. The folks that don't, how to get started. And for those that are unsure, some questions to ask internally to see if you do, how to leverage it. If you don't, how to implement it. Hopefully anybody that's on that spectrum, we could provide some guidance to the group. So looking at the funding landscape, the funding landscape for infrastructure and energy projects is really more robust than ever. Thanks in part to major federal legislation like the Inflation Reduction Act and the Bipartisan Infrastructure Bill. These programs are unlocking billions of dollars for hospitals to modernize systems, reduce carbon, and increase resilience. Federal programs are often complemented by state and local initiatives, often targeted toward energy upgrades in underserved areas or public serving institutions. These can include matching capital grants, tax abatements, or even technical assistance to help prepare shovel-ready projects. On the utility side, hospitals can tap into demand response programs, rebates for high efficiency equipment or equipment replacements, and incentive structures that reward load shifting or emissions reduction. The key to accessing these opportunities is knowing where to look. There are great tools like there's a website called desireusa.org, which provides a state-by-state breakdown of available incentives. And the EPA also has a greenhouse gas production fund portal that are excellent starting points. If you don't know what's available in your area, those public resources are a great place to start. Or you could reach out to Chris and I, and we could try to help answer that question for you. Together, these resources form a dynamic patchwork of funding that, if navigated strategically, can significantly offset capital expenditures. So shifting into, again, what we believe is kind of the essential structure here, which is engaging the right stakeholders for effective project planning. A successful infrastructure modernization project begins with assembling the right team. I think a lot of people know that. There's a lot of folks at the table when making these decisions, from design and construction to engineering to facilities to finance, legal, etc. Without those folks, it's tough to make the right decisions or make the right decisions in a time-effective manner. Their alignment is vital to ensure funding pursuits match the operational priorities. Everybody working towards a shared goal. Externally, subject matter experts are often the difference between success and missed opportunity. Whether it's ESCOs, specialized consultants, or legal counsel familiar with grant compliance, their role in shaping proposals and managing risk cannot be overstated. Clear governance through steering committees or task forces creates accountability and keeps timelines on track. And also don't forget the utilities. Engaging them early helps to optimize the incentive participation and infrastructure feasibility. They are partners that you can lean on. Many do, many don't. But they do have teams usually that are looking to help, and they themselves have goals to help implement the incentive programs that they are managing. Additionally, broader community partnerships can also amplify social impact, improving the odds of winning competitive grants. One of the most overlooked but critical aspects of infrastructure upgrades is how they affect utility budgets and existing energy supply contracts. Even positive changes, like reducing consumption, can have unintended consequences if they shift peak demand or trigger contractual penalties. You can start by modeling how your project will alter demand charges, possibly time of use rates, and peak consumption. These insights can drive better design decisions and improve that return on investment. Next, ensure alignment with fiscal planning. Projects and savings must be integrated into operational and capital budgets to avoid approval delays. Many facilities that we work with are locked into long-term energy supply contracts. These contain clauses that can penalize sudden load reductions or possibly require renegotiation. Early review and coordination with the team that overviews or implements those contracts is an essential part of the project planning process, especially when you're looking at fuel switching projects, going from steam chillers to electric chillers, or having anything that would have a significant impact on your gas consumption, installing distributed generation. All of those things need to be and should be considered within current contracts and future contracts. Lastly, you can consider bundling energy efficiency upgrades with technologies like battery storage or even solar PV. Doing so can smooth load profiles, reduce exposure to high rate periods, and open the door to additional performance-based incentives. I will note here that solar PV, the incentives are going away rather soon, which was a change through the One Big Beautiful Bill. So that is something that if you're looking to do, to seriously consider trying to make progress on those projects before July of next year. The One Big Beautiful Bill does not remove credits for batteries. And it also does not change some of the federal energy efficiency incentives like 179D that organizations can still pursue. But all of those things really do still require all of the steps that we've described and discussed here. And with that, I'm going to pass it over to my colleague, Chris.
Thanks, Jeff. I think it's also kind of important to in the discussion of the ITC to kind of go over kind of how the federal changes may or may not affect incentives and grants at the local or utility level. We get that question a lot around, is the federal change or a federal change in government and policy ultimately going to affect the incentives? From what we've seen, utility incentives are really not dictated by federal policy. They are ultimately funded by the ratepayers, and that's really dictated by state level kind of goals and objectives. And so those haven't really changed. They've been very consistent over the past 10 years through whatever federal administration was in office. And so we don't really see those as a risk of drastically changing because of that. Similarly with obviously state grants, that's really more at the state funding level. And so those also really haven't seen drastic changes like the ITC is undergoing currently. Jumping into kind of the business case and to kind of get a little specific. So often we see customers in that capital planning cycle. It's usually was due like a month ago if your calendar year was January 1, your fiscal year was calendar year aligned. And we don't see a really proper justification of some projects. The boiler's failed or the boiler's 40 years old, and we're submitting a CapEx request for, I don't know, $4 million. And that's really the kind of summation of it. And it may have some scope. It may have a contractor quote assigned to it. It may have a controls, an electrical scope. So it's kind of a robust scope, but it is not telling the story of what the savings and value is per se to the organization. Ultimately, we all understand that that CapEx is a financial decision first and foremost. And so putting some type of model in place that A, shows the energy savings, B, shows the avoided maintenance, and C, potentially tries to tie the risk into the actual cost model, creates value and also hopefully moves you up the priority list. Because ultimately, at the end of the day, we all know that everyone from every department is requesting capital in some form or fashion, and things are prioritized. And so if you can tell the story effectively, you can kind of move up that priority list to ultimately get these projects funded. Second, incentive stacking. Now, incentive stacking for a single project typically isn't allowed from a state versus kind of utility level, but we see very consistently across multiple states, there are kind of state incentives and grants around studies. So developing a preliminary scope, doing an energy audit, depends kind of the form or fashion, but those programs can be funded to kind of help you start the path to identifying the project. And then once the scope is clearly defined, you can also capture a utility incentive. We'll go through a case study that kind of highlights that. But that really is the path to success. If you can start the journey through a grant and then use that to ultimately kind of like present the capital and the ROI of the project, that has a much higher chance of success. The next is combining high ROI projects with critical kind of end of useful life equipment projects. That kind of has two reasons. One, obviously, if you combine a 1-year ROI with a 10-year ROI and they're a similar cost, you're going to get around a 5.5, and that's a much better story than the 1 and the 10. Jeff, we may have lost the screen. Apologies, folks. I will share. Just give me 1 second. I think that's coming through. I'll give it a second to load for everyone. Okay. Getting back to combining ROI projects, there are some incentive programs, especially in the Northeast, that actually incentivize comprehensive projects. So if you do a lighting project, a controls project, and an RTU project or replacement or a chiller optimization, those projects on their own may qualify for 20% incentive of the total cost of the project. Versus if you combine them all together, you can get 40 to 50%. So thinking through more programmatic, and again, Jeff had kind of mentioned meeting with your utility reps, they can help you ultimately like figure out what path to an incentive program is best. I think that's really key to maximizing that incentive. And then lastly, there's a lot of soft reasons to execute projects from what we've seen. Obviously, you have resiliency in healthcare that is imperative. You have potentially compliance and safety reasons. You also have patient comfort, employee comfort, and all of that is kind of ancillary benefits that if the story isn't told, then no one realizes, oh, the amount of control we're going to have in the OR is improving significantly. And that is valuable to the doctors and potentially to the maintenance staff so that we can address problems more quickly, know when there are issues, and give ultimately the patient the best experience possible. So to go through a case study to kind of put some practicality to a lot of what we're talking about, Maimonides is a hospital in Brooklyn that we've been working with for a while. We started with them through what is called the OSEM, or On-Site Energy Manager program, which is funded by NYSERDA. NYSERDA in 2024 had 100% cost share for nonprofit healthcare. So they paid the complete bill for us to basically begin as the energy manager at Maimonides. And that's a 2-year program. Through that, we were able to stand up an energy committee. And I'd really say it's energy and sustainability, and we'll get into why. And that allowed us to bring kind of that diverse group of stakeholders together. We have legal, we have supply chain, we have all the different kind of property managers, facility managers, because there are obviously, like, there's the major hospital, there's a lot of offsites. And that allows us to more quickly kind of address problems, address compliance issues, and ultimately kind of action a lot faster than they were previously. One of the biggest focuses, Maimonides is in New York City. New York City is facing Local Law 97 for the first year. There was a special exemption, effectively, that you were allowed to apply for as a nonprofit hospital before the end of the year. And by doing that, they were able to offset a significant portion of the Local Law 97 compliance that they were facing. And that was really actionable because of that energy committee being created and understanding what the scope of Local Law 97 was and when that kind of was going to come into effect. The second is NYSERDA also funded a flex tech study, they call it, but it's an energy audit where effectively an ASHRAE level 2 audit is performed, and that ultimately provides a list of projects and an asset inventory that can be kind of updated in real time. It's kind of a living document, as well as provide some guidance and some high level scope on what projects should be prioritized and what projects are valuable, both from a carbon perspective as well as a cost perspective. That ultimately allowed us to apply for 2 $600,000 grants for chiller conversions from an absorption chiller to an electric chiller, basically a fuel switching incentive. And by prioritizing the fuel switching, because that is where the dollars are from an incentive standpoint now in Con Ed territory, we were able to basically capture $1.2 million in incentives. I should also mention that the audit itself was covered by NYSERDA as a part of that cost share model. So there was very little out of pocket other than the actual infrastructure itself, but all of that development work and the committee was all stood up at no cost to the hospital. The last piece is, and I think this is an interesting grant because we're starting to see different channels kind of incentivize hospitals in different ways. NYSIF, the New York State Insurance Fund, provided an opportunity to all healthcare institutions a 5% rebate on their workers' comp insurance if they create a climate action plan and begin to execute on the scope of the climate action plan, and also iterate every year that climate action plan. It's basically due every April, May timeframe. That allowed them a significant rebate. In this case, it was up to $250,000. I believe it's capped at about $1 million. And that work obviously had a tremendous ROI and almost immediate from a rebate perspective. And then lastly, there are many times where grants come very quickly. We see so often, I could think across 4, 5, 6, 7 states where the grant opportunities come and go in 2, 3, 4 months. And so if you don't have a list of projects that you already have kind of like scoped and understood, and B, a committee that can actually action on it, that can assign work, that can kind of develop the scope and prioritize tasks, you're not able to ultimately apply for those grants. And so New York State put out the Empire Building Challenge for hospitals, where if you put forth projects that are electrification and resiliency based, they will help fund those projects at 50% of the cost. And so because we had done stood up an energy committee, because we had done an audit and kind of knew the scope of the projects and started to advance that ball down the field, we were able to actually apply for this grant as a part of that committee's kind of initiative. And then lastly, I kind of mentioned it, but just mitigation of Local Law 97 fines. making sure we understand what the risk is ultimately, how large was the fine, if we mitigate it, what is the impact. I think this is also really important if you're facing a building performance standard, because ultimately it is another incentive opportunity. It's another ROI based opportunity, right? Ultimately, that project has a certain amount of carbon savings, and that carbon savings directly is reducing the fine whenever that fine starts. Um, I will mention just building performance standards are all over the map. New York City started this year. There are many that don't start till 2030 or 2035 or 2028. So whatever jurisdiction you're in, I would just make sure you kind of understand that scope. And if you have any questions, please feel free to reach out to us. In terms of also looking at kind of ROIs and how to actually plan, I would say the energy committee also should really look at when it's beginning. I know about half the group really doesn't participate or isn't involved in that, but setting a baseline is kind of square one. You can't plan for where you want to go. If you want a 2% overall energy reduction, if you want a carbon reduction, you can't set a goal or even some type of goalpost, whether that's an internal goal or an external goal, without understanding where you're at. What is my current energy usage? And if you have data that predates that, if you can go back to 2017, 2018, 2020, it's really interesting to see what the trajectory has been. It also kind of aligns with some infrastructure upgrades, but kind of tracking that and beginning to understand every quarter, every year, where were we from an energy perspective? Why did we have, large changes in July or August? It allows you to kind of question the data. Second is understanding, and engaging with those like Con Ed reps, in Maimonides' case, with NYSERDA directly and their healthcare team. If you have those relationships, you understand what's coming, you understand what the needs are, and you're able to kind of cater your projects to affect that directly. For the climate action plan that we need to create for NYSIF every year, without having the stakeholders all in the same room to understand why they need to answer the supply chain questions or the employee-based questions that are required to be included in that climate action plan, I don't think we would have been able to execute. Ultimately, trying to bother everyone individually via email a lot of times doesn't have a whole lot of success, especially when we're all running around. And so having that committee together to understand why we have to do the climate action plan and what the benefit is to the hospital fundamentally kind of sets us up for success. And then lastly, I think with any energy committee that's just starting, trying to capture those early wins and kind of prove the value, it allows everyone to kind of get that buy-in. When you receive a $600,000 incentive check, everyone's eyes light up. They understand the value. They understand why the work they did to get there ultimately was successful. I will say on the reverse side, we've seen many cases where the boiler broke, the chiller broke, or there's a significant maintenance issue, and it becomes a rat race to replace the chiller, and no one's even thinking about incentives. And I understand why, because ultimately the patient comes first. So planning correctly and not missing the boat on sometimes a six-figure incentive is really important. And we see that time and time again. Without the planning, you do not get the execution. So to wrap up, in terms of kind of the last slide, we have an action plan. So how do you start, right? I think for a lot of facility managers, just creating that energy management team and building an energy management plan is really important. It is not easy to get the buy-in. It takes kind of that leadership initiative or leadership's agreement that this is important and they understand why it is important. So creating that kind of governance. Second, I think the facility team at times needs to have cohesion before you can then start to pull in those secondary stakeholders. So understanding kind of the maintenance team, like making sure that the facilities team in terms of maintenance, in terms of health and safety, EH&S, potentially the like offsite managers, that you are all on the same page and in terms of what the goals are, in terms of what you're trying to achieve, and have a structure to that and how you're trying to track and manage the energy usage of the facility before you then try and kind of bring in those outside stakeholders, legal, marketing, finance, etc. I also think step one is always understanding what equipment you have in your facility. So if you do not know or you do not have an asset list that is a living document that gets updated when equipment is replaced or equipment breaks and new equipment is installed, you're not setting yourself up for success. You ultimately, if you can't answer the question of like what equipment do I have in this mechanical room versus that mechanical room, it becomes infinitely more difficult to plan. And then it also goes back to if you have the asset inventory and you have that baseline, then you can start to look at what opportunities are in effect. Um, Identifying kind of what the history has been for your geography, I think is important. Where are the utility incentives going? They are very different. As an example, in the state of Ohio versus in New York, that Maimonides has. It's very different in California than it is in Texas. There are incentives, there are grant opportunities, but you need to understand your local jurisdiction. Um, I also think a lot of the grant cycling, especially through the states, is cyclical. So they may have short windows, but at times they are biannual every year. You can kind of expect those and start to plan for them accordingly. Like I said about trajectory, I think electrification is a big push across the board. I Electrification can't happen everywhere all at once. I think, as we all know, the grid couldn't magically just flip a switch tomorrow and support that. So it's about looking at what incentives can be maximized, what equipment is readily, available to electrify. We kind of call it smart electrification. What systems make sense from the hospital's perspective to start to evaluate to capture that maximized incentive. Most importantly, is it going to save costs? The last thing we want to do is increase the cost of the utility bills because we're putting an electrified system in. From a lot of our work, we've also seen that electrification, it's not just the boiler room or it's not just the chillers. It kind of comes down to what is downstream of that system. So how are you using the energy? Ultimately, you could put a Cadillac of a heat pump system in the boiler room, but if the steam pipes that are distributing that need to all be replaced with hydronic piping, that's probably not attainable. So what other options are there? And I think thinking through that strategically of where do we want to be in 5, 10, 15 years as our equipment becomes end of life, that's electrifying smart. And then lastly, I think just getting the right buy-in, understanding like the team, if you're going to invite someone to the meeting to kind of be a part of that energy committee, I think it's really important for them to understand the why, to set a goal, set a standard, set an expectation that really leads to success. So to kind of recap, I think making sure you understand what your equipment is in your facility. B, make sure you understand what your energy usage is, and then look to start to create that energy committee so you can start to be more prepared as these grants and incentives become available. I don't know if we have any questions. It looks like we have one in the Q&A box from Ariana. Please feel free. We can kind of see the Q&A section, so happy to use that as kind of the primary tool. It looks like Ariana asked, I work for a utility rebate program here in the Tampa area. What do you think the best approach is to get the attention of utility or facility managers to make them aware of the available incentives? That's a great question. I think at times, kind of presenting a case study or some form of proof point is the most important aspect. A lot of times people don't understand what the value is. Sometimes they're understaffed, and we see that a lot in healthcare. If people are under-resourced, they just simply don't have the time to focus on energy. And it needs to be kind of a programmatic approach. Otherwise, it is very difficult to have it successful. But from what we've seen, trying to have a monthly meeting or at least a quarterly meeting with the utility is successful. And I think both that's from the utility's perspective and the facility manager's perspective, but they ultimately need to see the value. And so, like I said, if you can show a case study of projects you've completed at other healthcare institutions, what the benefits were, both financially as well as like secondarily, patient experience, employee experience, etc. I think that really leads to success, and that should help you get engagement. I think at times it's also just getting to the right person. I think sometimes the structure of some of the healthcare organizations we work with is complex, and who's responsible for what isn't always clear initially. And so making sure you kind of understand that so you can approach the right person, Ariana, I think would make you successful. Jeff, anything to add there?
I think that was a great response. I think the only other thing for that initial question to me would be consider the other. I mean, getting time is a challenge. We really appreciate the folks that were able to give us the time today, but anybody else that is getting into or working with those facility managers, they're a great way, a channel partner, if you will, to act as a conduit to get that information in front of the right decision makers and the right folks within the respective hospitals.
Thanks, Jeff. We have another few questions that just popped in. So I'm going to kind of go through in the order they were received. Kevin asked, working in Texas Southwest region, Southeast region, excuse me. I don't notice many state local incentives. How do you work around states with so few funding channels? I think every state is different. I will say, at least specific to Texas, there are utility incentives. Texas is a very complex region just because the utility landscape is so disparate. There are so many different utilities, there's municipalities. So understanding specifically what utility you are in is important. I would say AEP, CenterPoint, kind of the larger ones in Texas do have incentive programs. I will say that a lot of times incentive programs are not marketed that well. So often we are educating our customers on even what the program is for their state or their jurisdiction. So trying to do that research, it takes some kind of review of utility websites to kind of dig in. A lot of times the fastest way is to get in touch with someone who runs the incentive program and kind of have those conversations. So yeah, I think the Southeast, there are some states that really don't have any incentive programs, to call it what it is. So Mississippi and Alabama, they have very little incentive programs. Texas is a little better. It really comes down to like the state of the grid and how they're trying to incentivize savings. Jeff, you want to take the next one from Beth?
Sure. So the next question, what are your recommendations for small hospitals, 112 beds in rural areas to start an energy committee? Any resources available? I would say that there are some resources. I think that smaller hospitals sometimes provide a good opportunity because you understand who the stakeholders are. I think it's just taking that initial first step, regardless of who that staff is. There are people that can assist, maybe not the facility director, the chief engineers, etc. There are folks that are available, but I think it's really just starting with trying to collect the data, starting the conversation internally, starting to track, even if it's not formal, the projects that are being completed. To Chris's point, what do I have? At what age is it? Starting with even finance potentially. But I think getting that momentum can be a challenge. But if you start the conversation, it can really get the ball rolling down the hill rather quickly. Chris, anything to add?
No, I think that well covers it. I think education, maybe. The only thing I would say is just utilizing the free resources you have. I also think tying who is buying energy at your facility, who's making that decision. I don't know if it's the CEO, CFO. They need to be involved in that conversation because they would understand the value of the energy reduction and ultimately the cost savings that you would also see. But utilizing ASHI, utilizing other resources, potentially looking at certifications or trainings like certified energy manager, those can be really good tools to kind of give people some, like experience around what is available. I think so many people just don't even understand what the opportunity is, and like checking that first can lead to success.
I will.
Next, we have. Oh, go ahead.
I was just going to say, Beth mentioned the hospitals in central Maine. Maine does have higher utility costs on average as compared to the rest of the United States. So energy is likely a decent expense even for a smaller hospital. So that will help with the return on investment. But even that, using that as kind of the lever to pull, that managing this rather large expense can drive significant value for the organization. Maine is just one of those states, the Northeast broadly, and California are some of the higher overall average utility costs. So that is also a lever to pull if you're looking for a place to start.
Kyle Cross, how much work or projects have you done with organizations that have very little to no capital? Savings on operating expenses is helpful, but you have to pay for the projects first. Just mostly looking at grant opportunities with no match. Um, I think a lot we've been able and have seen, especially in some cases, almost 100% cost share in with certain initiatives for a lot of the development work. I think the reality is there is always a cost to ultimately replace the chiller. You're never going to get that completely for free. There are a few examples where that's a little different. We've seen like FEMA grants for generators that have fully funded those projects, but that's a very rare exception. I think if you are looking at it from a like we don't have any capital available, but the equipment is still failing. Um, you need to look at kind of alternate financing if applicable. Again, that's sometimes hard with credit ratings and whatnot, but we have seen that successful, especially if it can be kind of utility or savings based incentive financing. I'm not sure where you're based, Kyle, but sometimes the utilities have kind of on bill financing available. Similarly, Jeff was talking about energy contracts. There's also some paths to having your energy contract kind of finance the project, and that really pushes the cost from a capital expense to an operational expense. So we've seen that also have some success in the healthcare vertical. Jeff, anything to add?
I mean, it's no capital is a challenge, but we do see that obviously a lot within healthcare. I think Chris is right. There are ways, there are funding opportunities. There's ways to amortize that cost operationally. There's organizations that specifically look at trying to finance the installation of these projects. Again, to Chris's point, sometimes that's a challenge, just to your cost of capital versus the financing rates, et cetera. But there are pathways. So if you have any other questions, Kyle, about that, we'd be happy to dig further into that. There are healthcare specific organizations that do look to finance or help with the financing to nonprofit organizations. What I'll also say is that even if you can't do the work, it doesn't take away from that structure, that foundation that you're building. Where do you want to get to? What am I, where could I be? Where do I think I could get in that 10-year, life cycle? Collecting the data, analyzing your operations, doing that work, I think, is still productive. To Chris's point, when the opportunity does come, may be an internal capital or some type of grant incentive opportunity, that you're ready to mobilize. And all of that work is important, should be done, even if you're not planning for some type of capital allocation within the next 12 to 18 months.
John has another question. When building an energy committee, what level of participants' titles is best, e.g., worker bees, managers, directors, C-suite? I think what we've seen is most successful is a C-suite person needs to understand that that committee is important and kind of sponsor it, for lack of a better term. Usually that's COO, I've seen kind of commonly. It can also be a CFO if the energy decisions ultimately roll up to that CFO title. So they're the ones that are kind of setting the like expectation of that group. I would say who's doing the work. A lot of times we see kind of director of facilities, director of sustainability, if that's a role at your organization. Those types of folks are typically involved, along with their, someone from their team may join as well. We also see kind of director of capital projects or design and construction, just because those are kind of intrinsically tied. Ultimately, capital projects are still executed by their team, so planning those projects accordingly is important. And then I would say some type of kind of VP level of facilities. It depends on the organization, but VP of facilities, VP of infrastructure, something to that effect. It depends how big the organization is. That person usually, they may not be in every meeting, but they generally understand what the agenda is each month, what the kind of objectives are, and are kind of responsible for it, with the C-suite being the sponsor of the initiative. Jeff, anything to add there?
No, I think it's great. I mean, it's ultimately looking to make sure that you have the knowledge in the room. To Chris's point, it's the people that are making the design decisions, the people that are operating the facility. There are chances to bring in stakeholders ad hoc or intermittently as necessary to understand the challenges in the field, from the worker bees from this question. They sometimes can bring great insight into the decisions that are being made, and sometimes they're not always asked to be a part of those decisions, and that can help to build buy-in from this group, and again build that momentum. But you are looking to make sure that at some point, and Chris nailed it, that the critical nature here is making sure that the executives within the organization understand the nature of the committee and what it's looking to accomplish, and providing the guardrails, the documentation, a charter potentially, if you will, saying what it is that we're doing, why are we doing this, how are we communicating information, when do we meet. All of those things are critical, and making sure that you have the staff to meet the needs of what you're discussing within that group. And again, sometimes that can include external stakeholders from outside the organization. Somebody that maybe manages your energy contracts could be a person that could bring value to that committee. The engineering teams that you work with externally, all of those folks could be a consideration for that external party that can also bring value.
Awesome. I think that is kind of the end of the list of questions. So I think that's everything we have for you today. So just want to thank everyone for the time. I know taking 45 minutes or an hour out of your day to listen to us talk about incentives in everyone's busy schedule. So we appreciate you joining us. And I did see a question about sharing the deck, and I believe that is correct. The kind of documentation will be shared so that everyone has that information of what we presented today.